Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The efficient exchange of dental instruments between the dentist and the dental assistant is one way the operating team can simplify chairside procedures. An effective instrument transfer technique benefits the dentist by conserving motion, saving time, and reducing eye strain. During this program, we'll demonstrate an instrument transfer method that offers these benefits to the operating team. To begin, let's take a look at an operator working alone without the benefit of a dental assistant. Take note of the following as he retrieves an instrument from the bracket tray. Rotation of the upper body and use of the entire arm. Loss of eye contact with the operative field and a delay in focusing on the desired instrument. The effect of this method of instrument retrieval is loss of time, operator fatigue, and eye strain. Compare the instrument retrieval method just shown with this instrument transfer technique using a skilled chairside assistant. Again, take note of the key points. Less motion is required by the operator to exchange instruments. The transfer is quicker, and the eyes can remain fixed on the operative field. Effective instrument transfer techniques should have certain characteristics, such as requiring only one hand of each team member, conserving motion, being compatible with most instruments, allowing the operator to maintain eye contact with the operative field, and it should be relatively easy to learn. The pickup and delivery method meets all the selection criteria rather well, hence this method will be described in detail. The development of the skill required to execute this instrument transfer method first requires an understanding of the relative positions of the hands of the operating team. The assistant's left hand is divided into two parts. The thumb and first two fingers are used to transport and deliver the instrument to the dentist. This is referred to as the delivery portion of the hand. The last two fingers of the hand are used to pick up the unwanted instrument from the dentist's hand. This is referred to as the pickup portion of the hand. Using these two portions of the left hand, efficient transfers of instruments can be made between the assistant and the operator, regardless of whether the operator is using either a pen grasp or a palm-thumb grasp. Here is a pickup and delivery exchange of instruments with the operator using a pen grasp. This time, an instrument exchange will be accomplished when the operator is using a palm-thumb grasp. Now, in a step-by-step fashion, we'll demonstrate the pickup and delivery instrument transfer. The assistant prepares an instrument for transfer by grasping the instrument at the end opposite the working end. Next, the instrument is rotated as needed to position the working end so that it is oriented to the area being treated. When working in the maxillary arch, the working end is turned up, and it is turned down when working in the mandibular arch. Once the instrument is held properly in the assistant's left hand, it is brought into the transfer zone in front of the patient's face. The instrument is held in the ready position, which is about 10 inches away from the operator's hand. Maintaining this distance will avoid crowding the operator and will help to prevent false starts of an exchange. As the operator is using an instrument, his hand is in the working position using the pen grasp. The operator signals the assistant to begin the exchange by withdrawing the instrument from the working position by bending the fingers. This avoids unnecessary verbal communication. The handle of the assistant's instrument is positioned so that it is parallel to the handle of the instrument being used by the operator. This paralleling procedure is essential to prevent tangling of the instruments during the exchange. The finger rest is still maintained during the transfer. Maintaining the finger rest in the work area minimizes movement the operator has to make. In addition, this localizes the operator's hand so that the assistant can make the exchange without chasing the operator's hand around the transfer zone. By standardizing where the operator's hand will remain during the instrument transfer, the exchange can be made without the operator looking away from the operative field. Once the operator signals for the transfer to begin, the assistant extends her pickup fingers and grasps the non-working end of the instrument. The instrument is then lifted slightly upward out of the operator's hand and tucked into the palm of the assistant's hand. Next, the delivery portion of the assistant's hand places the new instrument into the operator's hand, which completes the transfer. If the instrument just received by the assistant is to be used again immediately, then the assistant can shift the instrument from the pickup portion to the delivery portion of her hand. This is accomplished by pressing the thumb against the handle of the instrument and rolling the instrument against the fingers back into the delivery position. The first two fingers have to be lifted over the handle of the instrument in order to position it properly in the delivery portion of the hand. This technique of instrument transfer can be used with a wide variety of instruments. Since the exchange of hand instruments has already been demonstrated, let's begin with an air-water syringe. The air-water syringe is a rather easy instrument to transfer despite its bulky size. The key to a successful transfer lies in the fact that the assistant holds the tip of the syringe during the transfer. This leaves the handle available for the dentist to grasp when the instrument exchange is made. Notice that the assistant parallels the tip of the syringe with the hand instrument. When the finger signal is given, the exchange proceeds as previously described, except that the operator must move his hand off the rest position slightly to receive the syringe. The assistant bends her wrist slightly after picking up the hand instrument in order to position the handle for the operator to grasp. Scissors are transferred in a similar manner as the air-water syringe. The scissors are held by the tip and paralleled with the instrument in the operator's hand. After the finger signal is given, the exchange is made. Again, the operator's hand must move slightly off the rest position to place the fingers into the holes of the scissor handles. The assistant can retrieve the scissors from the operator by grasping the tips of the scissors with the pickup portion of her hand. The rubber dam forceps are transferred in a similar manner. The operator receives the forceps with the palm up for both maxillary and mandibular areas in most instances. Cotton pliers are used to transport cotton pellets, articulating paper, matrix bands, and other materials of this nature to and from the oral cavity. Whenever possible, Loctite pliers should be used to simplify the instrument transfer. However, since locking pliers are not always the most convenient for every procedure, a modified technique is required when non-locking pliers are used. The dental assistant has to change the approach to instrument transfer slightly to avoid dropping the contents of the pliers. The pliers are squeezed firmly in the delivery portion of the hand. They are then paralleled with the operator's instrument and the transfer proceeds normally. Pressure must be maintained by the assistant until the operator has a firm grasp on the pliers. After using the pliers, the operator signals for an exchange and the assistant picks up the instrument at the working end to avoid dropping the contents. The operator's hand has to be moved away from the patient's face slightly to accommodate this exchange. The exchange of one handpiece for another poses a potential problem of hose tangling if the transfer is not executed properly. Since transthorax delivery systems are in common use, a popular unit such as the one shown here will be used as an example. Whenever multiple handpieces are to be used during a procedure, the burrs should be placed in the handpieces from left to right in the order of their use as shown here. As the handpieces are exchanged from left to right, the hoses will not tangle and the unwanted handpiece can be returned to the unit in a trouble-free manner. However, if the operator has to return to a handpiece that was previously used, or in other words, reverse the direction and go from right to left, then a modified instrument transfer must be used. This modification is called a reverse pickup and delivery transfer. In this case, the operator's handpiece is picked up with the thumb and first two fingers of the assistant's left hand. The new handpiece is delivered with the last two fingers of the assistant's hand. This is the opposite of the normal transfer method described previously. Remember, it is only used when the progress from one handpiece to another is reversed. Watch what happens to the handpiece hoses when a normal transfer is used, but in a reverse direction. The transfer is correct, but the tangled hoses inhibit a smooth return of the unwanted handpiece back to the unit. This impedes efficiency and leads to unnecessary aggravation for the operating team. Here's a practice exercise that has been developed for dental auxiliaries that will aid in learning the pickup and delivery transfer. The assistant simply holds one instrument in the left hand and another in the right hand. The left hand now represents the assistant's own left hand, and the right hand now represents the operator's right hand. Instrument transfers can now be executed between the assistant's hands to simulate the exchanges that would occur during a procedure. The reverse pickup and delivery transfer can also be practiced in the same manner. An effective instrument transfer technique is truly beneficial. A little practice is required, but the rewards are there for the operating team in terms of increased efficiency and a more enjoyable way of practicing dentistry.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.